Hi, my name is Dr Luke Madden. I'm one of the osteopaths at Health House Clinics. I'm joined by Dr Caitlin Begley, one of our chiropractors at Health House Clinics. We've shown you how to release your glutes using a couple of tennis balls. We've shown you how to release your back using a tennis ball and how to make your own Health House Clinics branded back ball. We're now going to take this and open up through the thoracic spine. So a lot of the things that present to our office on a daily basis is people with poor posture, or upper neck pain, or your typical office worker syndrome, or the worst one is your text neck, where everyone's looking down and texting or iPadding or swiping left or right. So, that was my joke, dad joke. So, using this homemade back ball, we're going to release all of that upper back tension that people get from using technology or from sitting in an office all day. Caitlin, I'm going to ask you to lie on your back with your head up to the centre for me. What we're going to do, so with the back ball that we just made, as I mentioned before, we've got the nice little groove that your spine will sit in, and then these two tennis balls will put pressure on the muscles on either side of each segment. If Caitlin is quite stiff through her upper thoracic spine, so let's go around the level of T5 to 6, which is the middle of your shoulder blades, I can sit Caitlin up, place this back ball here, and lie you back down over the back ball. Now, how's that pressure?
That is nice.
We're lying, you're going to be truthful to the audience.
It hits the spot.
Okay. So we're already getting some sort of inhibition through the muscles. If you don't know what inhibition is, spinal muscles contract and relax. If there's an irritation of a segment or a disc or the nerve, the muscles can go into a spasm. Okay? Inhibition is where you put pressure into that muscle, which will release the spasm because you're turning the nerve supply off. At the moment, we're just doing some simple inhibition. If we want to encourage some movement through this thoracic spine as we're releasing it, Kate, I'm going to ask you to bring your arms straight up in front of you. And from here, you can just let the weight of the arms push down into those balls as well. But we can also start to engage movement. So in this position, I might have you bring your hands down until they touch me and up until they touch me. So you can just work within these kind of limits. This should be, I don't want to say pain-free, this should hurt a little bit, but it shouldn't be causing intense pain. If your symptoms persist, see your health professional. From here, the shoulder blade has a couple of movements. We can protract, where we bring our arms forward, or we can retract, where we return the shoulders to their original position. Okay, then I'm going to ask you to protract, and now we've opened up through the scapulars, so now you're feeling increased pressure through that shoulder blade rhomboid area. And I'm going to get you to once again do those upper and lower movements. Now, if you're still finding this a bit simple, we can add a Swiss ball. Here's one I prepared earlier. I'm going to get you to grab hold of that Swiss ball and repeat the exact same thing up and down. So Caitlin's in a protracted position. Now retract, keep the arms straight, and do the exact same thing. You'll often find one is worse than the other. Caitlin, which one's worse?
This is definitely worse.
Okay. Now, the other thing we can do is side to side. We don't want the left side or right side to miss out, so we can offer the ball this way or this way.
We have a new worse.
Okay. Let's try protracting the scapulars, so lift the ball to the ceiling and do the exact same thing. Have we got a new worse, or this is actually better?
No, this is nice.
Alright. So let's say we've released Caitlin's T5, T6, and she's a little bit sore higher up or lower down. I'll take this from you. Sitting up for me. I can place this slightly lower or slightly above. I'm going to go lower this time and repeat the process. Arms up, and you can go up and down, or you can protract and do the exact same thing. And you can do this anywhere along your thoracic spine, which is just above your navel or your belly button to basically where your collarbones sit. That's it for our thoracic series. We're going to do one last thing with the balls. We're going to teach you how to release your suboccipitals, which is where you get common headaches. But for office posture, this is a really good self-rehabilitative position or exercise that you can do from the comfort of your own home. One other modification you can use for this technique for the thoracic spine is we spoke about increasing load by adding arm pressure. What we can do is ask Caitlin to lift her hips off the bed, which will now add all of her weight going through those two, a home-based Health House Clinic back ball supportive device is now increasing pressure through those muscles. So if you found just lying on your back and doing some arm rotations or a Swiss ball rotation didn't help, a little bit high please, we can really add pressure through here. Now describe what you're feeling through the camera, Caitlin. Pain. If this is still not enough, and I know that Caitlin's really wanting the next level, we can repeat said procedure Touching, there we go. Describe, the camera can't see or see the facials that I've said, so explain what you're feeling.
The most pressure I've felt in this exercise.
Let's try some protraction with it. There we go. Okay, so now we're at next level. So now we've got most of Caitlin's weight pushing down on those muscles. So if you're one of those crazies that really like pain, this is the position for you. And bring it down and up, or you can also go side to side. Now, if you don't have a Swift ball at home, you can also use a foam roller. And that's really the series. So, have fun at home. Thought I'd give you that little bonus section. Thanks, Kate.
You're welcome.
I didn't get my thumbs up. There we go. Now we can press stop on the video.